A new study released by Stats Canada says that almost 50% of healthcare workers suffer from high levels of stress. Among the highs were nurses, doctors, and lab technicians. Melissa Oakley spoke to one nurse to find out how she copes with the stress.
Stacey Carr is a registered nurse at the Dr. Everett Chalmers Hospital. She has worked there for the last 10 years and knows all too well how stressful the job can be.
It is difficult work environment because, like I said, you're working with a lot of new unexperienced staff. You have more patients to look after. We don't get the respect that maybe an accountant would, or it's that type of thing. So we get a lot of, besides our working conditions, we're kind of being hit by abuse from other areas.
The 2003 Canadian Community Health Survey says that 67% of nurse supervisors reported high work stress. This was one of the highest in the healthcare occupation. Carr says that handling this kind of stress at work is possible because of her family.
I've been married and I have 2 little girls, so when I leave here, that's all I think about. That has helped for me personally. I think you need to have a lot of extracurricular things going on so that you're not just working, going home, and doing nothing. I think having other things to look forward to help. Also, who you work with is highly important. I look at a lot of these nurses that I work with. My type of schedule, I see usually the same faces regularly, so I look at them as almost family members.
The Chalmers Hospital has resources to help their staff deal with stress.
There is a program which called In Confidence that people can call if they're having problems related outside of work, or if you're having stress difficulties within work.
Like so many other nurses, Carr does the job because nursing is rewarding.
Every time you discharge a patient home, I work on a floor that is, we have a lot of injuries. So people in car accidents, that type of thing. So when you see them come in and they can't do anything for themselves because they have multiple injuries, and then you get to see them to the point that they're leaving with crutches or what have you, and getting their organization for their home and getting them home, I feel that's rewarding to see a positive outcome. Being in the hospital.
Gladys Milliken is a patient in Carr's unit and says that nurses are very important.
Well, they have to be. They have to be good to people and good-natured and everything else. I know they meet pretty rough ones sometimes. People are nasty, but not me. I couldn't see any sense of being nasty. I wouldn't know how.
Nurses face some of the toughest demands in the healthcare industry, so it's not surprising that they also face some of the highest stress levels. Hospitals do offer their staff, though, programs like In Confidence that help them deal with their stress. For Stu Journalism, I'm Melissa Oakley.